As we engage today, let us reaffirm our shared responsibility to build systems that are people-centered, integrated, and equitable.
Eliminating cervical cancer means saving lives, protecting families, and advancing sustainable development goals.
Our school-based HPV program has made strong progress in several districts. Single dose coverage has exceeded 80%, and this demonstrates the impact of political will, community mobilization, and intersectoral collaboration.
So I think the one thing that Abbott's done, we've developed an assay, a test that can, group 14 high-risk HPV types into, 5 meaningful clinical categories. And what this does, it helps develop a more distinct understanding of a woman's risk profile in a single test.
What the project then showed us is that integration is possible, it is scalable, and it is essential. And integrating and collaborating at community level as well as the health system level is what will get us to achieve the WHO targets that had been set before us.
And so today, one of the big things to emphasize is around integrated testing. And I think that's a critical thing because the minister did mention around, integrated care, but we don't hear often around integrated testing. And so some of our equipment really does provide that. Today, we are able to test HIV viral load as well as HPV on the same platform and multiple other disease areas, STIs and so on.
And so in thinking about how do we break the barriers for women to access testing, the self-sampling kits are one example of what United has also invested in. But what remains a challenge is that we're still confronted by a lot of regulation barriers. Why don't we have more of these tests being made available to communities for me to go test myself at the house and bring my sample back?
I think a few things stood out. It's very clear from everybody's discussion that prevention is better than cure, and we have to work on it for it not to be worse than this situation that I put here.
I need to keep on looking that those patients have access to treatment, and we need to work together to do that. This is not a one party solves the problem. This is an all of us solves the problem. And why? Because we were born and it's our right. Thank you.